12:35. It's time to get started. Welcome, everybody. This is the Clinical Consultation Network. I've been careful to say we're going to review some of our greatest moments today. We've had a lot of great moments, and if yours wasn't selected, it'll probably be selected the next time we do it. So just hang in there. But we selected a few different retro. This is sort of like if you used to watch Happy Days or some shows like that, where they come to a point that they just look back at a retrospective of some of the great moments that they've had on those shows. This is sort of like what we're doing today on Clinical Consultation Network. So glad you could join us for this. And this is also going to be, there's going to be some audience participation affiliated with it. So as we review each video that we've got selected for today, we're going to want you as the audience to respond to some questions that Carrie Donarajan is going to put up for you in the chat box. And then we'll review some of those responses that we got. So, and these may be informational questions. They may be more or less just your interpretation of something that might have been said in there. Just ways to get the conversation going. So, Babs, do we have our upcoming CCNs for me to talk about before we launch in?
I was so worried with getting this set up that I forgot to do that.
Oh, well, that's okay.
I can quickly tell you they are Christy Tyndall, Joey Ellis, and then a NAD collaboration are coming up.
Okay, so we got some good things on the horizon for our CCN audience. So please join us these next few weeks for those exciting presentations. With that in mind, I guess we'll go ahead and get started. This first video that we're going to look at is by Dr. Susan Bott. If you'll recall, she talked to us a lot about borderline personality disorder, about hospitalizations and how they work with people in Kentucky regarding their inpatient treatment. And she also, her interesting fact was that she writes books for adolescents. I thought that was a very interesting fact that she shared when she came on CCN several months ago. So Babs, with that, I'm going to say, let's start looking at our interesting moments here, our greatest moments, and Dr. Susan Bott. Really cool. Thank you for sharing that. And of course, you in your typical life here, you're a neuropsychologist, and you've worked a lot with people with borderline personality disorder. So you've got a presentation to share.
Right. Up here in Kentucky, the service system is got some similarities to y'all, but it's also very radically different in a lot of ways. The state hospital is still a thing up here in terms of there's a handful of private psych units that have about 10 beds in our catchment area, but essentially we are the only psych hospital in town. So we get everything from the distressed banker whose wife left him to the SMI. So we are a full functioning psych hospital, but we don't function anything, I don't think, like the psych hospitals in Tennessee that are more limited by your gatekeeping system. We have a gatekeeping system that gets roundly ignored by a lot of folks. And there's been enough times that our director's been snatched off a golf course on a contempt warrant that basically we're under the instruction if the patient shows up with a court order written on a napkin, we're to admit them and ask questions later. So we still get, we don't have the limitations, I don't think, that the Tennessee system does. Now we are very limited in beds. So we can't, fill up and stuff like that. But the IDD system also has some similarities and differences. But there's sort of some missing components that the psych hospital ends up filling. When I first came here, there were a lot of patients with, whether you want to call it borderline personality disorder or behavioral dysregulation, who essentially lived at my hospital, even though they weren't supposed to. Yeah. And I put a stop to that. So if I ever need nursing home services or IDD services, please get me out of the state of Kentucky, because I'll just be murdered if I'm putting a program here. But we've been working.
Explain a little bit about that, Dr. Bott. What's your concern with having people with borderline personality disorder?
I don't mind having people with borderline personality disorder at the hospital. I mind having people with borderline personality disorder living at the hospital, especially if they're IDD, because we have no habilitative programming and they lose skills. So they'll sit up here and get less and less able to function in the world, number one. Number two, we don't have access to any of the deinstitutionalization resources that the ICFIDs have. So if they get sort of that institutional dependence or institutionalization, we're an acute care psych facility. I have no ability to do a prolonged discharge process that would help them integrate into the community. So it sets them up for failure. And also, at least initially, although that's changed now, because it was a psych hospital, they weren't eligible for that high level of funding that they would get coming out of the ICF. So basically, we'd be coming. Who here has a program? These names? Anybody from like a IDD, SCL? I don't know what y'all call them there anymore. The homes where people live.
Supported living.
Yeah.
So
Do you have some supported living folks here?
yeah,
Dr. Davis, you're muted.
Carrie has posed our question here for the group. So with that, let's see what some of the responses are. What are your thoughts about the following statement? Long-term hospitalization is ineffective. Let's hear from you. And I don't want you to feel like you've got to go along with our premise for the questions. You can also dispute what's here. But we want to hear from you. So I'd like for everybody out there to go ahead and respond to that question, if you will. Then we'll review some of the responses. While we're waiting on people to respond, I just want to say that part of our ethos here with the Clinical Consultation Network is that we invite disagreements about things. We want to hear different perspectives on some of these things that we're talking about. I think that's the only way we end up getting educated about what we need to be doing and adjusting our thoughts about how to approach things based on a good conversation that we're having about what's effective, what's ineffective. So please enter your responses in the chat. We're looking for everybody to enter a response, whatever you may think about this topic. Okay, we're starting to get some responses here. Here, Carrie said she loves that she stated that they can go for services, but people with borderline personality disorder shouldn't end up living in a hospital long term. That is very easy to get to. I've found over the course of my career that people with borderline personality disorder often become very comfortable in a hospital setting, and it's great, but it's not reaching maybe as far as they could in those circumstances. So, very good comment there from Carrie. Candy Turner has said, not sure what the alternative would be. I think it needs to be carefully crafted to address the needs effectively. Okay, that's a good point. And so I think what Dr. Vaught is trying to say here is that those services, that we can craft them carefully so that people can be successful in the community. Emily Hawkins has stated she agrees hospitalization is short-term acute stabilization and usually should not be not able to provide long-term care. I think that is, whether or not it's most effective or not, that is absolutely the opinion of the funders of services, as well as psychiatric hospitals across the state of Tennessee, at least, that we want that to be short-term, want people to get back to their community environment as soon as they can. Vicki Tonis.
Sorry, this is Emily Hawkins. I actually wanted to add to that. I work for a psychiatric hospital, and some of the long-term care issues really are like being able to provide the needed care that some patients need, those long-term, like different therapy services, like for whatever reason, I haven't had lunch, so my brain isn't working, but occupational therapy and things of that nature that we're just not able to provide, that would really help that long-term care of an individual in a hospital.
Yeah. Okay. Thank you for that, Emily. Mickey Tonis said long-term care is necessary until our social, medical, and environmental technologies improve. Okay, there's another perspective on that. Doris Small says multidisciplinary teams need to meet to address appropriate placements and plans of treatment. Okay, that's a great comment. Thank you. Donna Stevens, I like the Harold Jordan Center that helps with skills and positive treatment plans. Okay, thank you for that compliment to our facility where I am broadcasting from today. Mickey Carey says, Mickey, you're right. More investment in community services is so needed. Absolutely agree. I should have written maybe necessary, Mickey says. Okay, thank you all for those comments. Those were some great comments that we had there in response to that first video for today. So appreciate everybody participating. Now, I hope more people will start to weigh in here on this next one that we're doing, which was, and I think I'm right, that we're doing Wendy Elmo next, correct? Is that correct, Babs?
Carrie has the questions in order. Was it?
I can go either way. I've got whatever order you do, I've got them ready.
I had Timothy next, but
Timothy next. Yeah, that's what I had.
I'll put Timothy right here next. This is a great one. Johnny Payne is with the START program here in Tennessee, and he's the assessment stabilization team manager for the Chattanooga unit, and he has a guy that he's been working with named Timothy Whitehair. If you remember back to this, Timothy was a guy who is a self-advocate, basically. And what he did was trained his own interdisciplinary team how to support him the best. And so this was a great episode of CCN that we had. I feel like we got some of the greatest response from this particular CCN episode that we had. So let's listen to Timothy and Johnny for a little bit, and then we'll talk about we will have a question. Carrie will post a question for you based on this this presentation. Go ahead, Babs.
All right, okay. All right, which one do you want to do first?
I'm not gonna read off this. I'm gonna read my own. My mood disorder has affected me a lot because it has made it where with my mood outburst, people don't like being around me. Like I have lost multiple friends over my mood disorder because they said that I was too dangerous to be around because of how my mood would be. And I've lost some friends that won't even talk to me nowadays, and that's been 8 years, and they won't even talk to me. Every time I see them, they ignore me.
And it doesn't feel like that's fault. Like you didn't make a choice to like have the emotions that you.
No, and I finally got to the point where I said, maybe I don't need them. Maybe I need to more focus on getting my mood in charge of me so I can take care of it and fix my moods. And that's what I have done over the past 8 years.
Tim, just a quick question there. So what have you done to work on your moods? How have you improved there?
Me and Johnny's discussed this a little bit. I've practiced deep breathing. I practiced meditating by just sitting there and listening to music. Not really a song with lyrics, but more a song with a beat. And I'll just sit there and breathe while I'm listening to it, while I'm calming myself.
Oh, that's excellent.
You've also grown a lot in like your ability to say what you're feeling out loud.
Speaking of that, there was one day I was really upset. I texted Johnny out of nowhere and said, "Can you call? I need you." And me and Johnny called, and about 5 minutes later, I was good.
But why?
Because I feel like talking about your mood will help you better than reacting with your mood.
Oh.
And I used to have a big problem of reacting with it.
A lot of people do.
So
not just you. Yeah.
So you've gotten a lot better with that over the course of time and got you some resources that help you do that.
Yeah, and my hypertension.
Yeah.
My hypertension, it bothered me because got me a job at McDonald's, and I kept having these problems of I wanted to faint, got lightheaded, wanted to pass out. And I finally, it worked. It was going on for about 2.5 weeks, and I finally got where I looked at the people in the company, my team, and was like, I need to get this figured out. I keep getting lightheaded. It's affecting my work. And it got to the point where I literally passed out at work and I had to be hospitalized. And we found out that it was the blood pressure medicine I was on was making my blood pressure low. And that affected me because I had to quit the job that I liked.
Wow, that was truly one of our greatest moments here on CCN. I really loved what Timothy had to say that day about his own self-advocacy and training his team on his hypertension, on other issues that he had experienced. So our question for you is, what are some steps providers can take to improve self-advocacy with the people that we serve? So I'd like for everybody to go to the chat and to provide a response to that question for us. And we'll start reviewing some of those questions, some of those responses. So we got Mickey Tonis here has responded. And Mickey says, when including persons in meetings, direct questions and comments to the person by name or preferred pronouns rather than talking about people in their presence. That's so important in a way, certainly, of getting a person engaged in their own mental health care or their own health care. Candy Turner says, listening to people. Very important. Learn how to question people so they will be able to share. Questioning is a skill. I agree entirely there. That's a great comment. See what else we've got. Donna Stevens says, listening to wait a minute. People we serve should be a voice in all their daily living skills and staff that create an environment that promotes their likes, dislikes, and daily living. Very good comment. Appreciate that. Carrie's not only asking the questions, she's answering them as well. The people we serve should be a voice in all their daily living skills and staff that create an environment that promotes. Oh, wait a minute. I just read the same thing I just read. That was not Carrie's comment. Educating them on their diagnoses and then letting them teach us about the impacts can be so powerful. And that is what Johnny and Tim did. That's exactly what they were doing there. And I loved how he wrote that out in his own words. You know, as professionals, a lot of times we're trying to reframe something or restate something for someone, which can be helpful. But in this circumstance, it's probably best if he could just say what is on his mind in his own words. I think that was one real strength of that. And oh, wow. Mickey says, well, East Tennessee represents. Absolutely. East Tennessee is one of our best regions. But the other regions are also great. So I'm going to be very diplomatic there. We love a lot of the stories we get from across the state. And Candy pointed out that we were allowing creative, if we allow creative ways to express things, that is another way. In writing is one way. Has anybody seen America's Got Talent this year? There's a fellow with cerebral palsy on there named Aaron Belisle, and he is doing his entire comedy routine via text. So he's basically on the stage with his dog sometimes, and he's texting his jokes to the audience, and it is hilarious. I encourage anybody to see that. And my point being, there are lots of different ways that people can express themselves besides just in writing. That they can express that visually. There were a couple suggestions here I saw somebody made about writing, using pictures, acting out, all of those things. Candy contributed. And then Carrie says, with 10 start folks, where are your answers? You all work hard at encouraging self-advocacy. I agree.
I'm calling them out, Bruce.
Yes.
I'm telling them, come on, guys. Answer the questions.
Here, Doris
Thanks,
Small
April.
says,
Thank you, April.
Okay, Doris Small says, listen to the client and allow him to communicate his thoughts without feeling judged or scrutinized. Yeah, so many times when we're questioning somebody, we're asking the questions with an expected answer or the answer that we want from them. What we really need to do is get down to what their heart is in this and what they really want to express to us and what they need to say. I was just working with a fellow over the weekend, and a lot of times he wants to hide his feelings or not really tell everything because he might feel like he's going to be ashamed of that, or that it's a negative thing if he reports any bad feelings. But it's so important to help people feel comfortable expressing those things. Some great comments there based on that video from Timothy Whitehair and Johnny Payne. I'm really glad that they brought that to us. That was certainly one of our greatest moments on CCN. Okay, so our next one, we had a lady named Wendy Elmo. She was also at the TNED conference recently, and she's a great presenter. She's with an organization called Brain Links, which provides education on neurological issues for people with traumatic brain injuries or intellectual disability or other similar disabilities. And so Wendy, I recall her interesting fact, one of her interesting facts, because she's been on multiple times, was that she does raise rescue dogs. And she has a couple of rescue dogs, one that has a limb missing that she has taken care of and has grown quite attached to. So her interesting fact was that she helps rescue dogs. And so she has some great information here for us about how to work with somebody who has a brain injury and how to help them feel comfortable and to be able to be successful. And so we're going to listen to a segment of her presentation here on CCN.
Talked about how cognitive reserve really helps us in a lot of different ways, but it helps us to preserve brain function and memory. Exercise is incredibly important. The exercise that's for our brain is the same thing. Basically, there's a lot more out there that's good, that research that we see is good for the heart. Anything that's good for the heart is generally good for the brain because it's usually going to be looking at blood flow. Exercise that increases blood flow and aerobic activity, cardiovascular activity, that is really important to be keeping those blood vessels throughout the brain, especially those little ones, healthy. We need that blood flow to the brain. Exercise helps with depression. It helps with, in fact, this to me is incredible. There was a study that looked at exercise for depression versus antidepressant medication for depression. And at 12 weeks, they were equally as good. They were equally as helpful. By 10 months, exercise was better. So if you are, I know a lot of people are having depression with COVID and not being able to do a lot of different things. Exercise. This is something we can all do, even if we do it inside our house. YouTube has so many videos. Find something, and you may have to force yourself to do it initially, especially if you are depressed, but do it because the benefits of exercise are unbelievable. My daughter is her undergrad is an exercise physiologist, and she says it's like the magic pill for everything. So it helps to increase focus. If you have anyone who has ADD, that is it's a good thing to help with focus. It decreases stress. It lowers blood pressure. It helps control blood sugar levels, helps you to maintain a healthy weight, it boosts your immunity, and so much more. And if you look at this list, this is similar to the list that I shared initially, that if all of these things, having depression and stress and high blood pressure and high blood sugar and all these things are bad for your brain, well, exercise helps with so many of them. So really important. Now, exercise like yoga is awesome too, and stretching. but yoga is gonna help more like with relaxation in the brain and that kind of thing. It's not gonna help with the blood flow as much as something that's cardiovascular. So we need to make sure that there's some aspect of cardiovascular. And now exercise actually helps with your memory. So over time, if we're not doing the right things for ourselves, the hippocampus, which is the area of the brain that is for memory and learning, it's involved with memory and learning, it can actually start to shrink and we'll start to see some memory issues. Exercise will actually help to preserve the hippocampus, but even one step better, they have shown that long-term exercise, cardiovascular exercise, will reverse hippocampal shrinkage. That's incredible. So I told you, there's good news here. It can actually reverse some of the bad things that are happening. And a lot of these things can begin to reverse some of the bad things that might already be happening in the brain. So it's always a good time to start taking care. Next thing.
Hey, Wendy, I was just going to mention one thing that you mentioned the COVID thing. And of course, I don't want to just make it all about that, but it has so many different, things that you're talking about here that are connected with this, because I think a lot of people who might have been really physically active before all of this have really dropped off a lot on their physical activity. And, depression we know is up as a result of all this. And we think, well, it's because we're being so isolated, which is probably part of it. But it's also the fact we're just kind of sitting around a lot more and not really getting physically engaged like we did before. And it's something that, we're going to be dealing with this for a little while longer. And we've got to figure out this piece. We got to make sure that we're addressing this piece for people. We were talking about this particularly for people with disabilities out there, that a lot of times everything sort of feels probably most of the time like it's out of their control, and even more so now. And this is a way, I think, of helping people kind of get back is trying to establish some sort of a regular exercise routine or a regular activity routine. Let's put it that way. Sometimes when you put the word exercise with it, that makes it more of a drudgery that you have to do. I've enjoyed, like, one of the things that has happened with me, somebody's mentioned that there's a COVID dog thing, like people are getting dogs because of COVID. I did that. And since I've been training my dog, I get a lot more physical activity from that, one thing, because he's very energetic. But it's not like exercise. It's like I'm just doing something fun with my dog. And so, having more activities like that for people, it seems like it's really.
So, yeah, absolutely. So a lot of people are taking this as an opportunity with COVID to gain a whole lot of weight and to not move and to be visiting the refrigerator a whole lot because it's right there and nobody's watching. Nobody can judge you for it. But we can also take this as an opportunity, like it's on hold. You don't have to leave the house as early anymore, and you don't have to drive home. So maybe one of those or both of those become your opportunity to really change your life. And hopefully we're giving you some reason to do that now. What I just did, because I just found it, is the Conqueror challenges. If you look up Conqueror Challenge, you'll find it. And it's this really cool thing. It'll be stupid to some people. For me, it's awesome. You sign up for some challenge. I signed up to walk El Camino de Santiago in Spain. And it's all virtual. You can do Hadrian's Wall and the English Channel and all these different things. And you get access to this amazing Facebook community that is so positive. So if you need positivity in your life, it's amazing. And just that the excitement around everybody's completing these challenges. And I tell you, nothing else changed except I signed up for this thing. And I want to get down on my elliptical all the time because that's the best thing for my knees. I have bad knees. But so something like that may work for somebody to get, and you can put your miles in however you want. There's a conversion chart. So look into something like that even. I have loved it. And you have this whole community too. And you can see where you are on the walk. You can put in where, your updated miles, and it'll show you what that specific place is, and you can look all around and see it. So it's really cool. Then
get creative with it. That's a very creative idea that you're talking about there. And I think a lot of times we don't think about plugging somebody into that. And sometimes, there's this phrase I like to use called taking the best you can get closest to what you want. You may not get the whole enchilada, and in fact, getting the whole enchilada might demotivate the person from wanting to continue. So just get what you can get and reward that and reinforce that and make it fun, and then add a little bit more as you're able to. That's the way I think help support somebody through that. And people, that's one of the things. A lot of people with disabilities really need help thinking about these types of ideas that you're talking about to get motivated. And just as you were talking about that, wanting to go to the refrigerator all the time, I was absolutely thinking about going and getting a Klondike bar right now, but because you said that, I'm withholding that. So.
Yes, think about what else you have there, any carrots or anything like that, because the next thing is eat well and start now. So I don't care how old you are. If you have a 2-year-old in your family, if you have an 80-year-old in your family, and whoever old you are, start now, because you will realize positive benefits. And I'm going to specifically focus on the brain, because we're here for brain health. So to eat to ward off Alzheimer's, currently, this is incredible to me again. And
Okay, we'll stop there, and we might have had a little bit of a mismatch of our question to the video there, but I guess here's what I guess I want to ask of the group is what strategies do you see helping people improve their cognitive function? We heard of a couple things here: exercise. We heard about eating well a little bit there toward the end. What types of strategies have you used to help people do these things, and what other things might there be out there that you could do to help somebody improve their cognitive function? So let's see what kind of responses we can get to those questions, and we'll wait just a second, give people a little bit of an opportunity to respond. But I don't know, Babs, Carrie, anybody out there, if you want to come off mute and tell us what kinds of strategies you've used to help you maintain an exercise routine, maintain an eating routine, those types of things that can be helpful in improving brain function.
Well, I just want to share, my grandmother had a club called the Wigs, and it was a word improvement game society, and they played Boggle and they did crosswords, and they were constantly keeping their brain sharp. And my grandma was sharp all the way till she passed away at 93, I think. So I'm all about games. And I had posted also about video games. My son, so going the other direction, a boy in his class did a research project on do video games rot your brain. And in his very limited study, he found that they actually sharpen your critical thinking skills, because you're processing the game. So now all the boys in the class tell their mothers, video games don't rot your brain. But that is something that the people we serve can actually be pretty involved in. But I love the exercise and eating well suggestions too. So I'll let other people address those. It looks like you're getting some comments.
Yeah, I mentioned before we started that I play on a trivia league. And so I like to do that to just prove to myself that I'm not deteriorating over the course of time. If I can still remember what general was the son of a president in World War II that died at Normandy, that's Teddy Roosevelt Jr., by the way. If I still can remember that, then I feel like I'm not, at least not deteriorating. So that's one of the things I do to help myself stay sharp. Sarah Muncher mentions here the exercising with someone. That way you've got someone for accountability. you know, if you just suggest to somebody you need to go out and exercise, that's not going to work as well as if you get out there and do it with them. And it really, you know, it could benefit all parties if you do that. It's sometimes so hard to commit to, though. I several times I've got my accountability partner, my wife, who says, "Oh, let's get up and go to the gym here at 6 a.m." And I'm like, "Oh no, I need to sleep a few extra minutes." But having that other person that wants to do it is certainly a very important thing. Um,
I
and
think, Bruce, if I could say something,
yeah,
because this will
jump in, please.
be too hard to type, I think. But when you're talking about brain injury, a lot of times people think, well, if you have a brain injury when you're older, your brain may not have very good plasticity to repair itself, and that is just not what the research is showing us these days.
Yeah.
And so we have to remember that you can while you do not, if you have a stroke or something like that, you may not recover those cells, but other cells can be recruited to do what those cells had done in the past. So that's all about rewiring, reworking the brain to take over. I've seen so many people be able to actually pair maybe something differently and actually start to access that area of their brain. So just being aware that not to give up, that, um, there is such a thing as plasticity that you can make gains
Still access.
even after injury and loss.
Right, right. Yeah, and you know, I was thinking about this movement or this project through the Department of Health called Building Strong Brains. And so, especially when it's kids you're working with, the neuroplasticity is much greater in kids. And kids who've been neglected often don't grow the neural contacts that that most people do if they've had normal interactions with their parents, if they've been neglected in some manner. But they talk about this strategy of serve and return. So it's sort of like you're doing a tennis volley with the person, and basically giving them questions to respond to, and then they're responding to the questions. And this helps people build their their brain, strengthen their brain essentially. And so, very good strategies, very good points that you're making there, Candy. Felicia Dutton points out getting them involved in the community, um, giving them a sense of purpose. These things kind of make those decisions more easy. And one of the things I tried to point out there too was that exercise isn't always exercise. Sometimes it's just doing activities and being very active in your lifestyle. Very good suggestions. Let's see. Shelby Butcher says trying out a new activity and building a new skill to keep the mind active in ways that might not have been before. Very good suggestion. Kayla Sharp says, owning dogs gives me personal responsibility to make sure they get plenty of exercise every day. She says, laugh out loud. I understand, though. Exactly. The only problem I have is I take my dog on a run while I'm driving the golf cart. But nonetheless, the principle is just exactly the same. I think it's very important, very good way of keeping yourself active. All right. Let's see. Do we have any other comments there? Kayla Sharp says she gets her steps in with her Fitbit as they get their steps in. Okay, yeah. So she's building on that last comment. Sarah Muncher, sales, staying active, independent living, exercise classes at senior citizen centers. Another great way of doing that. And Donna says, I like to volunteer with cancer survivors. They have comedians that we laugh a lot. Laughing is another way of keeping your mind active. And so community, being a part of a community is really good. Full participation in the community can help with that. And Babs points out sleep health, how important that is for cognitive function. I measure my sleep score every night with my Fitbit. And sometimes I'm very disappointed in the scores that I get, but I'm working at it. And I think that is important for everybody to work at if they want to have good cognitive health. Candy supports that. Sleep health is important. YouTube has some great music to help for that. So some very good comments there. We'll move on to our next video now. which is going to be, I believe this will be Candy Turner that we're featuring in one of the videos that we did. This was a whole panel, but the part that we're featuring here involves Candy. Candy raises Italian greyhounds. She also grows violets that she puts into competitions. So, and she and her husband are actually quite competitive at this, I understood from our discussion prior to CCN today. So here we're going to see a small segment that Candy presented on CCN. So
no agency should be without a policy to address this issue. So with that, let's talk about some risk factors. Candy, why don't you tell us a little bit about general education for staff and ways to understand and mitigate choking risks?
Okay, I have to unmute myself first. So, the important, I think general education is very important. And as we see, the numbers we keep, I'm going to say approximately 50% of the people who do choke do not have mealtime instructions written by a therapist. So that tells you they've never been identified with some kind of swallowing eating disorder. So if we just stick to concerned about those people who have mealtime instructions, we're going to miss some people who are at risk for choking. Really, it's a coin toss, half of the people who choke. So I think to thoroughly address those choking risks, all staff should participate in some type of general training for safe meal times. And I'm just going to go over some of the things we have in place. Relias, we've already talked about, has some great courses that are online that can be accessed for staff at any moment. They can pause it, go do something, come back, look at it, finish it. So it's real convenient. Health and safety alert choking is the one Karen Wills mentioned prior to this. I think it was put into the chat box. And then there's another one called an overview of safe eating and drinking, which I think is also really good. Dysphagia management with GERD is very good. The health and safety alert choking was completed, as Karen said, by us in DIDD. So it's very specific to our language of how we talk about food and what we know about choking. So that one's really a good one. It says it's about an hour, but it takes only about 40 minutes to complete that course. So that's a really time efficient course to take. Then the other things we have in the Regional Therapeutic Services team, each region can offer various trainings. I'm just going to mention some because there may be others out there that are being piloted in different regions that I'm not aware of. But mealtime challenges is one, choking and aspiration, a class called dysphagia overview. We've got mealtime safety for managers. I think we even have one that we developed in East that is for people who have IDD. They can attend to learn more about what they can do to make themselves safer and help be safe in their mealtime. And it's called, I believe it's Safe Eating Habits. So it's a really good course that has a lot of good pictures and a lot of good discussion comes up when we talk about it. And I think that's important to remember to teach people how they can be safe. We were talking about one day with the speech paths in the East. I don't think, like, if we are eating a piece of meat and we can't chew it, and all of a sudden we're realizing this is going to be too big, we have etiquette where we can pick up our napkin and spit that into our napkin and put it beside our plate and keep eating. And we started thinking, I don't know if people with IDD understand they can do that, So we thought, well, hey, let's teach them some things about safe eating habits. So that's kind of where that began. And so it's important for everyone, I think, to have training in this for sure.
Right. So our question is, what is a strategy that providers might employ to reduce choking risks? I think you can, build off of some of the things that Candy was talking about there, and just think from your own perspective, what are some strategies you might do to reduce choking risks? I just want to say that choking is one of the leading causes of death in our population. And so this is really important stuff. It only comes up, it's not that frequent. We may have had, I think, I'm remembering correctly, we had about 14 deaths related to that in the past year. But if you think about it, that is quite a lot. And it's certainly one of the leading causes, preventable causes of death that we have had. And so we want to just think here about what types of strategies can you use to try to prevent that. I can tell you one thing right off the get-go that is pretty important. Oh, well, Candy here comments screening. Oh, Lord, I've lost my place here. So Candy points out screening people during meals, just watching the way, observing people as they eat can help you know if there is a potential choking concern there. And Carrie says follow all meal plans and SLP plans for food prep and monitoring, which is a great strategy. But here's the reason that we might want to go beyond that is because we have had deaths among people who didn't have that problem identified before. And so it's critical to look, under both circumstances, but when they do have that plan, make sure you follow it. Agencies can educate staff and people supported on safe eating strategies to use during meal times, and across the state, we have training on choking that agencies can ask for. All they have to do is go to their regional office and ask for that training, and they can get it. Candy says, know the factors for the region: aging, risky meal actions, behaviors, medication side effects. You bring out behaviors there, which is such an important part. If people have a tendency to eat real fast, or if they have a tendency to take food from, that may be others' food or whatever, that you are careful about those factors. Sometimes collaboration with a behavior analyst can really help in these circumstances, between an SLP and a behavior analyst, or an occupational therapist and behavior analyst, to address some of these issues.
So, Bruce, I would just like to say, East just rolled out their pilot training on that for BAs and SLPs to try to help them understand reaching for each other, when to reach for each other. And I think that's really good to start something there. I think that we we have to think about this globally. And one of the things that kind of concerns me is I see people, um, I don't know if we could say refusing their mealtime, or not complying, or staff leaving someone doing things that put themselves at risk without continuing to refer. Do you know what I'm saying?
Yeah.
Leaving someone doing something risky. And I think people don't realize how risky that is, because they'll say to me, oh, he's eaten this way. He or she has eaten this way all their life, and it's going to be okay. So I feel real concerned when I hear that. And also aging. We found out in East Region that when people with IDD, not people in the regular population, not us, I'm talking about people who have intellectual and developmental disabilities, we're seeing their choking risk will double when they hit their decade of their 50s and beyond.
Mhm.
So people, we've got to educate staff members to think about, not, hey, I'm 58 or whatever you are, and I'm not really thinking about choking. So I'm not going to put that in my brain to think about for someone I'm supporting. We need to stop thinking about ourselves and our own age group and our own age risk, and realize that the person we're supporting has different risk. We must take their perspective, look at their medical history, look at their aging. We all know, I think there's plenty of research out there that talks about people with IDD have age related issues come up sooner than other people. So, just all these
Absolutely.
things. We've got to stop thinking of them as, hey, I'm 60 and I'm not going to fall, or I'm not going to choke, or I'm not having these problems. We have to stop that and think about that person.
You're absolutely right there. And I tell you, I'm 61, but I have noticed little warning signs of those things. I'm less stable than I once was as far as falling goes. I do aspirate periodically. And not maybe to the degree that some people with IDD do at times, but these things do start to happen as you age. So,
Right, you can see that, and I think we just have to realize the person who has IDD is going to age in a earlier manner, and we've got to be prepared for it. We need to teach people to be prepared. We also know that people choke in they choke more often on certain foods. We know this. They choke over 50% of the time. They're choking on either meat, bread, or meat bread combinations. We should be teaching that. They
yeah,
choke more often at lunch and dinner than they do breakfast. We should be teaching that. They choke more often at home than they do anywhere else. This is what we found in East Tennessee. And I believe that to be staff are distracted when they're at home. They're somebody, you know, they try to multitask or something grabs their attention and they take themselves away from helping that person in the meal. So when they're at a restaurant, maybe not so much. But anyway, these are just some clues that we're trying to tease out. What's the problem here? We do find people have some serious issues with choking. I mean, if they choke, they have serious consequences if they've had emergent psychiatric treatment recently.
mm,
Isn't that interesting?
yeah,
Don't know
very
why that is.
Yeah,
Don't know why that is.
that's something we need to continue trying to understand.
Yeah.
And Candy, you're illustrating how people can actually improve their policy regarding choking by contacting their regional office and getting
Yes.
additional training. Sarah Mutcher also points out, ensure that your agency has a policy for mealtime training.
Yes.
So important. And
Very
David
good.
Taylor brings out also, don't eat in vehicles. This is
Oh,
something
very dangerous. Yeah.
also talks about quite frequently, and it seems like we have had some deaths related to that. So this is just a very important topic, another very important topic, and this has been a great reflection on some of our greatest moments in CCN history. We've had a number of great moments, so we just had to choose 4 here today that we were going to review. But we have so many great episodes, and from time to time, we'll do this again. I think this has been a nice little interchange that we've had about some of these greatest moments. So we'll repeat this again in the future. Thank you all for being here on CCN. We do this every Tuesday at 12:30, so I encourage you to join us each and every Tuesday at 12:30 for CCN. Thank you so much. See you guys next time.